that self-medication thing. What do you think about that? Because like even nowadays, I think a lot of people just go to
Self-medicate.
Google, check out their symptoms and treat themselves. Do you think that's where like the future is going?
No, I don't.
No?
And even if it is, then like it has to stop.
Maybe because I'm just guessing like where's the future, because we have all these like social media things and
Yeah.
everything. Maybe in the next 10 years we'll have like a doctor who has like an Instagram account. They're going in live and they're like, yo, tell me your symptoms, me I'll tell you if you're sick or not.
But sometimes you actually have to physically see the patient and like inspect them and like palpate and like touch and see what the problem is. Maybe the patient is like coughing and he has a mass, but you can't see the mass through Instagram Live. Like you have
what's
to,
a mass?
like a growth, like cancer.
Oh yeah.
Like if the patient has like a growth,
you have to be hands-on.
you have to be able to like palpate and see where the problem is. And you can't do that through Instagram Live, can you?
Nah.
You can't.
Yeah.
Actually, you can't.
That's a horrible.
But the problem is people run away from
that's
doctors.
a horrible idea,
Yeah.
first of all.
Yeah, but the thing is, people run away from doctors because they're pricey sometimes.
Yeah.
So they'd rather just take that money and go buy antibiotics from their chemist. And the problem with Kenya is almost everything's over the counter now. Like
you can buy
antibiotics.
anything you want. You can buy over the
like
counter.
high-dose antibiotics
Yeah.
over the counter.
Mhm.
Like that's insane because in other countries this is actually not allowed.
Yeah.
But in Kenya, no one cares. I mean, as long as they're making money, do I care? No, that's how people are
Like,
thinking.
I've seen like even the way you can go to the chemist, and I've done it before.
Yeah.
I buy like some
give them this-
painkillers. Yeah, maybe just see some, Google some, stuff, and then go and ask for like painkillers and stuff. And then, he looks at you and then he's like, I know, but maybe if you try this would be better. Like they actually,
yeah.
no, they actually recommend like a doctor. They're like, I think you have Nini, so if you try this, and after like 3 days you can come back and like what?
Yeah.
So when you
it's
think
business.
about it, it's crazy because
Yeah.
this person is not a doctor, but they're still.
But this is what's happening around Kenya, is it not?
Oh, it is.
Yeah.
Oh, yes, it is.
People would rather spend the 3,000 shillings that they're going to pay for consultation buying antibiotics for like 1250
people are
or
not-
even 1,500.
Yeah, people are not paying 3,000 for consultation. Like 3,000?
Yeah.
What?
And 3,000 is even like the lower limit.
Oh,
People
yeah.
pay up to 6,000 for consultation.
Yeah. But it makes a very huge difference.
It
'cause
really does. Yeah. Because what if you have more than what you assume that you have? Maybe it's
Tricky.
just a cough. But what if you have like more than a cough? What happens then? What if you have like a whole infection? Then what do you do? And you're taking like cough syrup. That's not helping you.
Oh, yeah.
And then and then the worst thing is your body's building tolerance. So the next time when you're coughing, this medicine might not even work for you anymore. You know what I mean?
It's tricky. It's tricky. Okay, now, what do you think at the end of it you'd want to do? What would you want to specialize in? Because you're doing all these different things now.
Yeah.
But what do you think like you're gonna like settle
Specializing.
for? Kids.
I don't really know yet.
Or is there nothing yet? You
I
still want to
I'm
keep
actually
testing out?
liking obstetrics and gynecology.
Really?
Because that's what like I'm beginning with now.
Yeah.
And it's very interesting because
Plus, it's the one thing that you're scared of
yeah,
as
and
well.
and I feel like
So you need to understand it more.
Exactly. And I feel like as a woman, I'd want a woman to check me. If that makes sense.
Yeah.
Like I'm not comfortable with a man gynecologist.
Yeah.
Like do you, boo? But you're not gonna treat me. I'm sorry. You know what I mean?
Just think about it this way: you've walked into this this institution,
Yeah.
medical camp or whatever, and you really want treatment or checkup,
And there's only a man.
and there's only a man.
Then I don't have a choice, do I? I have to see the man.
Yeah, it's either that
Yeah.
or would you do it? Or you'd be like,
I'd
you know what?
try my
I'd
best.
rather go home.
No, honestly, first of all, like I try my best to not do that. But if
Worst
it's,
case scenario.
then I have to.
Yeah. You'd
Or
be
let's say like
okay.
you're giving birth and it's only a male doctor. You can't close your legs, can you? Because the baby's already coming out. You have to give birth. And the doctor on call is a man. What do you do?
Yeah.
You have to. Like there's no going around it. you know? But the thing is, if the field is crowded with female doctors, then the likelihood of getting a man is also very less because women are also coming up as gynecologists.
No, and I think that's so important because even like now we're seeing like the way you've said, like there are higher numbers like of just like women in general like getting into like this profession. So, and I think it's not just about that equality thing. It's like about so that even if a lady walks in, like you're like a lady as well, and I'll make sure you're comfortable enough.
Because I know what you're going through.
Yeah.
So if you were to have the prostate exam, would you rather a female or a male doctor?
What? Oh no, that's tricky.
Yeah.
That's actually very tricky.
Would you rather have a man or would you rather have a female do it?
I'll just tell you. I'll be honest. The checkup that I got, it was a guy who did it.
Was it?
What do you mean? Was it good? What are you asking? What are you asking?
No. Like, were you comfortable? Like, did you make you feel like you're comfortable?
Very uncomfortable.
So you'd rather have a woman do it?
And that's the thing. Like, because
There's no
now
right
if I'm
answer.
thinking about it, there's no right answer
Or
to
there's
that.
no wrong answer? Yeah.
No, it's crazy because, oh man.
So who would you rather do the test for you?
I don't know. Because from a lady's perspective, I'm like, yo, this would be embarrassing, man.
Yeah.
Because
Then a man, you'd be like,
the worst part about a guy, like, here's the thing. Let me just describe to you what happens. Like, you'd be there. This person would put gloves, whether they're male or female.
Yeah.
You actually have to bend over.
Yes, you do.
We make fun of all these things, and then you're like, oh, shit.
And then he sticks his hand.
Please. Please. Bad memories.
Oh my God.
So, but this comes back to how do you talk to like shy patients? How do you let them? How do you ease in? Because it's all like now even psychological.
Yeah.
Like you have to make them feel comfortable because you can't be just too professional and like.
The key, first of all, is listening. Like, you have to make the patient feel like you're actually listening to the problems.
Yeah. You're
And
concerned,
then,
eh?
Yeah, and then before you do whatever it is that you're doing, you have to be able to make the patient feel comfortable in that specific environment. Yeah.
Okay. Interesting.
Yeah. Like, you can't just be like, okay, I'm sorry, like, move your pants and you're doing your thing. Like, you have to sit down and be like, okay, what do you want? What can I do to make this experience more comfortable for you? Yeah.
Okay, we've touched a lot on like just, this medicine, just your path, your journey and everything.